Perfect. My name is Habib Sadeghi. I'm a family practitioner by training. I'm a DO, Doctor of Osteopathy. I think my journey, and it is a journey in terms of what I do and what I practice. What I practice is considered to be alternative medicine. I look at it as more of, I guess, integrative medicine, if you would. And what makes it integrative in general is, I think, clearly my intention, as well as what I've tried to do in terms of bringing in various different modalities to offer to patients. I've trained in clinical homeopathy and actually teach clinical homeopathy to other physicians. I have some training in anthroposophical medicine, as well as obviously osteopathy and manipulative medicine, because I think that's extremely important with any particular disease. The bulk of my clinical experience is in endobiogeny. Endobiogeny was started by two French physicians. One of the two founders is Jean-Claude Lapraz, MD, and he's still very much alive. And endobiogeny uses plant-based medicine to normalize our endocrine system. Hormones and various different things, and it's extremely effective. But I think far more important is the psycho-spiritual aspect of every patient and any particular patient that walks into my office, that I pay attention to that. I use various different modalities as needed. Such as German New Medicine or Total Biology, as well as some of the work of Roger Callahan in thought field therapy. If I have to teach them a particular tapping technique and so forth, if we find that there is a particular emotional upset that might have created a significant charge event for them, that I have found that to be effective. I called the center Beehive of Healing, Center for Integrative Medicine. Beehive came out of a conversation with Andre Gregory. Andre Gregory is a beautiful man and a fantastic playwright. And he started a company called, I think it used to be called Manhattan Project. And he did a movie called Dinner with Andre. And one time I met him and we spoke, and I told him that his movie inspired me. And he said, why? And I said, well, you know, when you were talking about going to Poland and having these improvisational groups and these beehives, that was really inspiring. So out of that conversation, I thought that the name Beehive, hive, a gathering of beings, that they're healing, for the purpose of healing, it would be very appropriate. So I took that as an omen, and I named the center Beehive of Healing. I think that's a pretty good introduction in terms of who I am and what I do and the particular modalities that I humbly bring to the table, while realizing that each of us have our own unique path and curriculum. I'm not a physician. Although I wear a white coat, I tend not to be paternalistic. And I realize that each of us, we have to work our own process, and ultimately the decision is within ourselves. So we know really what's best, instead of someone in a white coat telling us what to do. The cornerstone and the context of all these modalities that I offer is probably the biggest capsule that I have ever offered anyone, or I will probably ever offer anyone. And it's a pretty big capsule. Let me tell you how, let me show you how big it is. It looks something like this. It's pretty big. This capsule, obviously it's very difficult to swallow. So I have tried to put the context in a little pen that says love. And I offer that. So whether it's, whether it's cancer or flu or migraine headaches or, dysmenorrhea or some hormonal dysregulation or Parkinson's disease, regardless of what it is, I think this is a great platform to start with. Because we feel whole when we feel loved and when we are in a state of loving. And, there is a particular quote that when I had cancer, I actually wrote right here in my left thumb. And it's, the quote is probably the most precious quote, and it's very close to my heart. He who hasn't loved hasn't known God yet, for God is love. And I think that has a very powerful and therapeutic connotation. It had for me, and it saved my life. And it allowed me to carve out my own path instead of, I never forget the urological oncologist at City of Hope, just an hour and a half from here, probably one of the best hospitals in the world when it comes to traditional orthodox cancer treatment. They wanted to cut me open, and there was something about it that didn't resonate with me. And I think because I had started from that platform of love and really residing in that loving state, it allowed me to listen to myself and to follow my own intuitive sense. And I'm here to tell you that that was 1997, and it's May of 2010, and as you can see that I'm still here, and I feel very blessed. And that is the message that that I share with my patients, that I don't necessarily have all the answers. I can share what I know, but ultimately they have all the answers that they need. And as long as I can facilitate their growth so that they're not fearful, then they can make the decision that resonates with their authentic self, which is their true therapeutic self. Thank you.